New South Wales is facing the biggest challenge we have faced since the pandemic started.
Today, 44 new cases, 29 of those infectious while in the community. A kick in the guts for Sydney-siders already 2 weeks into a lockdown that now has no end in sight.
We have to quash the community transmission, because if we don't, we will see thousands and thousands of people in hospital and thousands of people potentially dying.
In response, outdoor public gatherings are now limited to 2, with a 10k radius for exercise. Just 1 person per household per day is allowed to shop for essentials.
Heartbreakingly, from Sunday, funerals will only be able to be 10 people.
The new restrictions are a far cry from where we started just weeks ago. From suggestions...
Can I strongly suggest, if you're getting on a bus at the moment, wear your mask?
...to mandatory-ish.
Well, we are going to ask people to wear a mask indoors in a mandatory way.
...to reassurances.
Now, at this stage, we feel that the response we're having is proportionate to the risk.
A lockdown off the cards.
A lockdown is not on the radar at the present time.
Then on the cards, kind of.
Is there a reason why you're not using the word lockdown?
You can use whatever word you like, but what is really important is for me to explain what our citizens can and can't do.
And today, the toughest lockdown measures yet. But are they tough enough? Among the new exposure sites, Kmart, Bunnings, JB Hi-Fi, Beds R Us and IKEA, which is responsible for 2,000 of today's 7,000 close contacts.
Do we need to see all retail except for those major department stores close?
What we need is for everybody to follow the rules that are in place.
The government accused of leaving too much wiggle room in the rules.
Aren't you, by not defining what's essential, forcing people to go to work?
I think people understand what is required when it comes to that. And we also don't want people unintentionally suffering if they can't access something they really need.
So, with no idea of when her city will now come out of lockdown, does the Premier need to go harder to get it done?
Strategic Health Policy Advisor Professor Bill Botel is here to give us his thoughts on all this. Now, Bill, you have been pretty critical of how the New South Wales government has dealt with the outbreak so far. Did they get it right with the new restrictions today?
Well, they haven't got it right in the last 3 or 4 weeks. COVID Delta drove straight through the quarantine arrangements at Sydney Airport, and it's driven straight through the lockdown arrangements we've had in the last 2 or 3 weeks. So I think today was a big turning point, I'm glad to say. I think that the Premier spoke very eloquently against the people in her cabinet and elsewhere who decided that the best idea would be to live with COVID Delta, with everything that would flow from that, and she put them in their place, which I'm glad to see, and really toughened up the lockdown restrictions. But they're still not as tough as the stage 4 lockdown restrictions that were used in Melbourne and that were so effective in knocking out COVID last year and COVID Delta a few weeks ago.
So, Bill, how do you explain that? I mean, everybody in the community in Sydney is saying that very same thing. And if the Premier is pointing the finger at those in her cabinet who pushed her into the soft lockdown originally, how do you explain the fact that she's not prepared to go tougher, because we know this variant is so much more transmissible?
Well, look, I hate to say it, but there's been a very big political battle between the live with COVID crowd on one hand and the people, I think, like the Premier and the Chief Medical Officer, who understand that there is only one way to knock this thing out. And we're presented with the compromise that seems to come out of the two factions having a political discussion or fight in the cabinet. Now, COVID Delta could not care less. It will just get on with replicating as long as people are moving around Sydney, and the virus will move with them. That's the only thing that matters.
So are you suggesting the 5 kilometre radius instead of the 10 kilometre? Because that is still a large section of the Sydney area that you can still travel within.
Yeah, no, I think 5 kilometres. I don't think any outdoor gatherings. I think masks must be used outside the home. All of these things were used in what really is the gold standard of responding to COVID Delta, and that's in Melbourne and Victoria. There's no difference between the virus in Melbourne and the virus in Sydney. As much as the New South Wales government seemed to have convinced itself that they did things differently in New South Wales over many months, that wasn't so.
Professor, we learnt this week that not a single case has been transmitted in the outdoors, and yet that's where today's new restrictions are. But the new cases are mostly in retail. Why wouldn't the Premier be bringing in more restrictions indoors, specifically in retail?
Well, I think it's a fair bet that a lot of pressure has been placed by the big retail interests to stay open. Well, that might be in their interests, but it's not in the interests of the public health of the people of New South Wales and of Sydney in a terrible way. I mean, staying open just serves the interests of the COVID Delta variant. And then it will just take us that much longer to get out of this.
Well, Bill, it is a sobering outlook that you're painting, but we do appreciate your insight.
Okay, thank you.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.